Hello, this is Dr. Do again. This video is on alphabetic list of problems. I think I finished the letter G. Today I'm going to start the diseases, start with letter H. The first thing came to my mind is the hemolysis or hemolysis. It depends who is saying it, but usually I like to say hemolysis. And some people say hemolysis. I think it's just the tomato probably. But what is hemolysis, and is there any emergency situation associated with the hemolysis? Yes, the most serious acute hemolytic reaction is the mismatched blood type. That's very traditional and very serious and quite common situation, but usually it occurred in the hospital settings. It's not in the at home or in the public, or unless there's some home care situation, but that's always associated with the always around the facility with physicians, and so that's probably the most common and most serious situation. It's really warrant emergency action to discontinue the blood transfusion and do anaphylactic reaction has to be stopped with the measures probably I mentioned before. So that is the emergency situation. There's some other hemolytic situation. It's even though it's not life-threatening, but still on the circumstances, you need to see your physician as soon as possible, even though it's not emergency. Probably when there's a question or not sure what caused it suddenly after you taking medication or after you eating some special food, you feel tired, chest tight, associated with the jaundice. So that's probably a sign of the hemolytic reaction. So going to the hospital or the emergency or call your physician as soon as possible is always the best, even though probably nothing really life-threatening, but just want to make sure to get it checked. Is any situation of this hemolysis you can manage at home? Probably I would say this. There's some hemolytic reaction. It's just that there's nothing need to be done. Just stop the offensive agent or offensive food, and then just drinking fluid, monitor like a 6-glucose 6-phosphate dehydrogenase deficiency. Sometimes just after eating the fava bean or after the medication causes this, then just stop the medication. But you still cannot manage at home because you have to be checked by the physician. Have to see doctor first to make sure to exclude other causes of this sudden appeared jaundice, feel tired, fatigue, and even itching on the skin. So these are the signs of hemolysis. But even though probably it's not urgent, or there's no need for medication, or there's no need for medical management, just discontinue the offensive drugs or food, but still you need to see your physician. So basically one word, if you have this kind of situation: no manage, no remedy, no regimen regimens at home. Have to see the physician to make sure to diagnose and to treat. So in terms of hemolysis, what are the hemolysis? Basically, it's just breakdown of the red blood cells. It could be caused by the genetic, could be some other diseases like the spleen, liver disease, or splenic or spleen diseases can cause this destruction of the red blood cells, and also could be from the red blood cells itself. The cell membrane lost the normal concave shaped function, like sideroblastic cells or the sickle cells. Because of the mutation from genetics, lost the normal structure of red blood cell membrane, so it tends to break down when they passing through the capillaries or the sinus, like organ in the spleen or the liver. They have a special kind of capillaries called the sinus. So when the red blood cells passing this structure can cause the breakdown and the hemolytic, or beyond the liver capacity to clean up. So these are the causes. On top of that, some medications can cause, even though there's no glucose 6-phosphate dehydrogenase deficiency, some medications still can cause the breakdown of red blood cells. So if that's the case, if you are taking some medications, I'm sure your physician already alerts you the signs, the side effect of those medications, and you need to be aware of those side effects, just in case if something happened that you knew it's a side effect, you need to talk to your physician to discontinue or just continue with medication and monitor this side effect. So basically this is the causes. And what are the signs? The signs usually for when the red blood cells break down, the most important or indicative chemicals are the bilirubin. The bilirubin has two forms, either free form or bind to the albumin. So regardless of what form, usually if too much of bilirubin in the body, in terms of whether it's conjugated bilirubin or free bilirubin, that's just the test for the laboratory to determine whether it is free or it's bounded. But in general, the elevated bilirubin just cause the staining of the skin, the eyes. You can see the white part of the eye starting to get yellow, or the skin getting yellow or bronze color. So that's the sign of the hemolytic, probably, if you have those causative factors like the medication or genetics. Or by the way, the jaundice doesn't mean only caused by the hemolysis. The liver disease, the gallbladder disease I mentioned before, all can cause this jaundice. But what I mean is if the red blood cells is break down, if there's hemolysis, one of the signs is also jaundice. And also associated with anemia, if it's severely formed anemia, chest feel tight or difficult breathing, feel fatigue. These are the signs, because we already talked about the function of red blood cells. If that's not enough to carry oxygen, you feel shortness of breath and chest feel tight. And on top of those jaundice, staining in the skin, in the eyes. So these are the signs. In terms of treatment, this, regardless of what the cause is, even though it's not emergency situation, you still need to call your physician. Even though you probably knew it, you have glucose 6-phosphate dehydrogenase deficiency, and you knew it, you just ate some medication, but still need to talk to your physician just to make sure, to confirm you're probably right. I had this genetic disease, I just took some medication, or I accidentally ate something really strong oxidant capacity, and then caused this. Even though you know it, probably it's a good idea still to communicate with your physicians. So regardless of what the cause is, need to talk to your professional, or talk to the professionals, to the physicians, and under the guidance from them, and then make sure either exclusive other serious disease, or even without immediate action, no need for medication, no need for treatment, but still need to talk to them. So this is the video for today about hemolysis, and I hope it just help you, give you some idea about what does it mean, and especially for those suddenly have itchy and yellow skin. It could be liver, or it could be the blood, the broken red blood cells. So I'm going to stop here, and thank you for watching. I will see you next time.